Good afternoon. My name is Keith Liu, and I'm CEO and co-founder of Skinopathy. And we are revolutionizing the future of dermatology. And so to better explain what we do at Skinopathy, let me introduce you to one of our patients. So this is Maria. Maria is a mother of 4, and she lives in Ottawa. And like any other mother of 4 especially, she doesn't have the time to go check on every bump and scrape on her body. But not until March of 2020. In March, she actually discovered a really bothersome bump on her neck. And so she said, hey, I need to check this out. And so she went to her family doctor. And because it was the pandemic, it took her a bit of time to get there, understandable. But when she got to her family doctor, he couldn't tell what it was. And so he referred Maria to a dermatologist. And 6 to 7 months later, she got to her dermatologist. And the dermatologist couldn't 100% tell what it was, but she thought it was probably very serious. And so she did a biopsy. And a little bit of time later, the biopsy came back, and it turned out that Maria had lived with late-stage melanoma for a while. And so she was then referred to a hospital. And when she got to the hospital, she was put into the system again to the hospital, but a few weeks went by, and she didn't get an appointment. So she called the hospital. She's like, hey, when am I coming in to remove my cancer? And she wasn't in the system. And at that point, she'd lived with late-stage melanoma for about 10 months. And that's when she reached out to us. And I remember this conversation really well, because one of the things that she said to us was, I am planning my funeral. This is something I'll never forget, and it was a very emotional conversation for all of us. And I wish I could tell you it's a conversation that's incredibly rare, that it doesn't happen that often. But unfortunately, it happens all the time. And thankfully for Maria, we were able to help her. And after about a year of living with late-stage cancer, she survived. But the reality is cancer, skin cancer, 1 in every 3 cancers diagnosed worldwide is skin cancer. And skin cancer outnumbers lung. Oh, did the presentation just disappear? Oh, but let me continue. So skin cancer outnumbers a variety of the next few cancers combined. And at the end of the day, that is why we had to build Skinopathy. And we are revolutionizing the dermatology circle of care via data and AI. I can forward. Thank you so much. And so you would think with all of this technology, telemedicine, et cetera, that what Maria had to go through would not be such a common occurrence. But the reality is that's not the case. Because even if you go to telemedicine, the reality is that doctor that you meet on the other end might not be the doctor that can actually help you with your specific condition. And that results in a lot of wasted time, valuable time in Maria's case, but also lost productivity for the physicians. So what if we can take all of that needs to happen, and bring it all to the beginning? What if we could analyze Maria's medical history? What if we can screen her medical conditions, understand maybe some images that she might have taken, maybe triage her, and book an appointment for her with a doctor that can help her right away? Well, that's what we do at Skinopathy. And what we essentially do is maximize each modality so that we get our patients the care that they need. And in turn, actually, it turns out that our physicians actually get to maximize their profit margins as well. Because at the end of the day, what we're doing is sending the patient to the right doctor the first time. And we optimize the care that they need. And so I talk about revolutionizing dermatology. And in our view, these are the things in dermatology that we need to focus on. And we are hitting every single one of them. And Skinopathy has been here. We're very young. We were about 1.5 years old. We've seen about 4,000 patients. We've had about 5,000 appointments. And 250 doctors in Ontario trust us with their patients to refer them to us. And we have 36 fabulous employees who are just as crazy and passionate as I am that believe that we can change dermatology forever. So let me share some of our tech with you. So Skin AI is our patent-pending AI. It's a suite of technologies. It can look at any skin condition, any skin disease, any skin cancer, and there are thousands of them. But beyond just screening for these conditions, we can actually track its growth, track the healing, and even help with surgeries. And our technology has been presented at the Canadian Burns Association, the American Burns Association, and just last night, our COO, Dr. Hannah Chan, and our lead data scientist, Dr. Rakesh Joshi, were at AI Med in San Francisco, where we presented our latest findings. And I'm very proud to tell you that last night we won the award for most valuable, or sorry, high potential in the medical field, which is an incredible honor. Thank you. And Get Skin Help is our patient platform. The one thing you probably are aware of, because we can all relate to Maria, is that the average wait time for all specialties in Canada is 25.5 weeks. But what we're seeing for skin, it's actually a lot longer. So in Ottawa, of all places, we're seeing wait times of up to 18 months. So that journey that Maria went through that was just over a year, that's actually faster than a lot of the patients that we see. Isn't that crazy? And then in Northern Ontario, our doctors in Northern Ontario tell us that their wait times are over 2 years. That is unacceptable. And at Skinopathy, through our Get Skin Help platform, the average wait time across all skin conditions is 11.5 days. And the fastest we were able to help a patient who did a virtual screening, did a virtual consultation, and came in to have their cancer removed was 4 hours total time. And that is only possible because of the medical software that we created that automates a lot of the medical workflows that need to happen, that allows us to triage the patients right at the beginning so we get them to the right doctor, and ultimately provide medical insights to our doctors who can take care of their patients better. And so at the end of the day, we take all of these insights and we can put them back into the patient journey and improve every step of the way so we can provide better care, faster care, and smarter care. And that's Skinopathy. So a bit about myself. I have about 25 years of experience in technology. I've been very fortunate to work for some of the world's largest tech companies, and I've had quite a few of my own startups. My first was about 20 years ago. I've had some great successes, and I have had some epic fails, but let's say I'm about even. My co-founder, Dr. Colin Hong, has over 30 years of experience as a plastic surgeon, and for the past 20 years, he's been building the medical software that is the heart and soul of what we do at Skinopathy. We are very fortunate to have a team of advisors and investors who truly believe in what we do, and as you can see from our investors, they're all wildly successful technology entrepreneurs, and they are guiding us to make sure that we get to where we need to go. And in the past 18 months, we're truly blessed to have all of these partners who not just support the work that we do, but believe in the mission that we're going after. And so if I can leave you with one final thought, we're a very new company, 18 months old, and it's truly humbling to be here. This is the most we've ever shared about anything that we do at Skinopathy. It's such a great forum. And so if anything I've shared with you today interests you at all, please reach out and join us to revolutionize the future of dermatology. Thank you.